Welcome to another episode of Vertigo for the Hardcore. This is your host, Sean, and I am really excited to introduce the guest of this episode. His name is Dr. Michale Bagnell. He runs the Bagnell Brain Center in South Florida, and I had the most amazing conversation, and I think that you are really going to enjoy this episode. So let's cue the music and get on with the show. Vertigo Nation, welcome back to another episode. I appreciate everybody joining. Please, if you're new here, go ahead and take a second and hit that subscribe button. And for everybody else who's listening regularly, I just want to say thank you so much. This is going to be a special episode for me recording it, but also I have a guest, which has been a while since I've had a guest, and I love when guests come on. And so today I'm going to be introducing Dr. Michale Bagnell. And I am going to let him introduce himself and talk a little bit about himself. But I think the Vertigo Nation is really going to be interested in this discussion because you are. That's just how it is. So go ahead, doctor. Why don't you take a minute, introduce yourself, please, and talk a little bit about your practice.
Yeah, I appreciate you having me on. I'm just hearing the name again, Vertigo Nation. And I'm thinking about our nation and like, wow, apropos. To a degree.
Yeah.
But aside from that, I've been in, my background started in chiropractic medicine, chiropractic healthcare. I originally wanted to go into med school to work with athletes in orthopedics, I thought. And on that journey, I kind of stepped to the side and went into chiropractic. And I really enjoyed that when I got there. But I was always fascinated with the brain. That was always, even in chiropractic, we used to have, at that point, they still did dissection. And we dissected the brain and we dissected the entire nervous system, right? We had a cadaver. I was fascinated with that. Although you smelled terrible for a whole year because of the formaldehyde.
I bet.
I loved that dissection. It was like, this is really what it's about because, we would think in chiropractic healthcare, it's about the spine and the bones. And yes, those are levers, but really what you're doing is you're starting to affect the neurology, the person's neurology. And so that was the beginning of the journey. And then many years later, I got into neurology for chiropractic physicians, for people who are postgraduate. And that was the beginning. That was 35 years ago. And it was just neurology. But many, many years later, it became neuroscience, right? Now it's neuroscience. And so I went back and I completed a fellowship in brain injury rehabilitation, which was a 3-year program, which was amazing. And we looked at all the nuances and the details of what different networks in the brain are doing and what they should do and how to analyze the brain and what happens with an injury and all these subsequent effects that people suffer with.
Sure.
And so, learning about that and understanding how to help rehabilitate from a brain injury, you can extrapolate that into other conditions because some people with brain injuries have depression, anxiety, and mood changes, right? And so, that's attention deficit type of projection, if you will.
Yeah.
And so as I started to go through this and learn all these different, the depth of clinical neuroscience and then the rehabilitation side of it, I thought, wow, this is going to be something that can affect and impact people across all kinds of realms, even if they haven't had a, quote, brain injury.
Right.
And then you start to realize that the majority of people have bashed their head or bumped their head or banged their head, even if you weren't diagnosed. Like myself, I've never been diagnosed with a concussion.
Okay.
And I believe I've had anywhere from 5 to 8 concussions.
Okay.
I played Little League football from, 45 pounds up to college.
No, you're
there.
right.
And then I've been in a couple of car accidents. Not my fault.
Yeah.
I had a few car accidents.
As you were talking, I was thinking about that because, I was a kid of the 80s. We really didn't talk about head. I was a wrestler. We didn't talk about head. Even in the 90s, we didn't talk about head injuries. So that's a great point that you bring up. The same thing with car accidents too. I've been in a couple, unfortunately.
Yeah.
So,
Sean, whenever I speak out in public and I'll speak to two different groups: lay people, like we're talking now, just
Yeah.
the average person like you and I. And then I also speak to doctors periodically around the country. When I speak to lay people and I ask, how many people have ever had some kind of head injury, concussion? Very few. If it was an audience of 50 to 75, I would say, yeah, maybe three or four.
Okay.
But when I get in a room of doctors, 100, 200, 500, I would tell you more than half of them say, yep.
Mm-hmm.
Why? Because they realized that they didn't have to be knocked out.
Yep.
They didn't have to be throwing up, but that they hit their head hard enough where they'd probably change some of the neurology just a little bit.
Yep.
And if you're high enough functioning, it's not really a big deal. If you don't have long-term symptoms, it's not a big deal. I'm
Right.
okay.
That brings up a good point. I was actually, and I'm going to plug your podcast at the end, but I was listening to the Neuro Collective specifically about the dizzy episode. I don't remember what number it was, but it was about dizziness, and it sounded to me, even though I don't know that you said vertigo, I think maybe you did, but it sounded like that, because that's one of the things that I'm very curious about. And one of the things that we
Yes.
had talked about before we started recording was vertigo. And so if you
That's
don't
right.
mind, is this okay for me to tell you this quick story?
Yeah, I want to hear your story.
Okay.
Sure.
Yeah. So, I 17 years ago, believe it or not, it didn't have a headache, nothing happened. It was a normal day, went to work. I'm a machinist. Nothing happened at work, just a normal day. Got home, went to bed. The next morning, woke up. I stood up out of bed, not realizing that there was anything wrong, immediately fell to the floor, almost like a magnet pulled me to the floor. I was that dizzy. And then I realized I fell to the floor, didn't realize immediately what had happened. When I
Right.
tried to get up is when I realized, like, whoa, the room's spinning like really quickly. So I went to the bathroom, and I ended up getting physically sick. At the time, my fiance, she called, the 911. She thought I was dying. And so I went to the hospital and went just through the ER. And I don't even remember the tests. I don't know if there were any tests. And the doc came back after several in and outs. You know how that goes, right? And then basically told me, you're having a spell of vertigo. We're going to give you some diazepam. That'll help treat the nausea, and it's going to wear off, and you're going to feel terrible. Take another one, and it'll go away. That was it.
Wow.
And
Wow.
I've actually dealt with it my whole life. I never have had a spell as bad as that initial spell, but I've never not been dizzy. I make a joke at work all the time, because if I turn my head and then look back, I get the sways, and I always tell people, I haven't been drinking. I didn't take a liquid lunch. Just I get a little dizzy. So yeah, that's really it. That's the story.
All right. So here's my question for you diagnostically.
Okay.
Do you feel it more when you turn one direction and back than the other?
I'm going to have to say that I think I do, because I don't normally look to my right. Like I don't look that way. I think I almost always look to my left for some reason. And if I do look to my right, I almost always physically turn my body, but I never thought about that until you just asked me. But yeah, so I would say turning to the right makes me feel dizzier. Just because I've adapted now, and I kind of go left. Even in the car, I realize that I shift my whole body when I'm looking to the right, as opposed to if I'm looking to the left, I turn my head.
Okay, it's interesting because so let's just dive right into this, right?
Okay. Okay.
The most common cause of vertigo for people, where the room is spinning or I'm spinning, is that we have crystals, quote, crystals that get loose and start floating around.
Sure. Yep.
This is called BPPV. You know it better than anyone, probably. That is typically a very simple fix. Very simple. And if we don't get it properly fixed or positioned, then we can adapt to it, but it's not the best thing for our brain, right? Whenever you have something that is compensated, it's kind of like you're carrying a heavy backpack. Yeah, I just don't turn to the right that much, right?
Right.
I'm compensated.
Yes.
And then your brain kind of will adapt to it, but it's not what we want. We want it to be fixed. I don't want extra energy to be siphoning off. I'll say it like that, siphoning off to try to stabilize this part of my brain in its integration. I don't want that. I want to drop the backpack, so to speak. I want to get the crystals stable, and I want to be able to do whatever I need to do, however I need to move my head at any moment without any changes, realizing that not only does it affect your balance, but it affects higher projections, the vestibular system, inner ear, into memory, concentration, gut function, spinal stability, muscle tone, so many things.
Right.
So, yeah, that bothers me that they would have said, yeah, take this and go. Yeah. And that is not uncommon. It's still bothersome to me because these things can often be resolved in a shorter period of time for people and really have a profound impact on someone.
Mhm.
I got to tell you a story once you just reminded me of one patient who had this.
Okay. Okay. Yeah. No, I think, and that was the weird thing. I remember, and right after that, we had a trip to New York City. We were going to take the boys to New York City at that time when they were young. And I remember like dreading that trip because I was so dizzy. And
Yeah.
the trip went all right, but I remember trying to keep track of, I can't remember how old the boys were, but they were young, they were like 5 and 7. And so, you're trying to keep track of them in New York City. And I remember thinking to myself, like, oh my gosh, I'm going to be sick because I'm, looking this way, looking that way. And like I said, it never really went away. So that's interesting. But yeah, and you're exactly right. You called it. It was one of those instances where it went in through the ER, I don't even think I actually followed up with my doctor. And not immediately. I mean, it came up in conversation at probably my next physical. I do faintly remember talking with him about it and him saying, oh, you went to the emergency room. What was that about? Kind of thing. And it was vertigo. And then him patting me on the back saying, be ready to have that for the rest of your life. Kind of, it was like,
Oh
oh,
my word. That is so completely inaccurate. That's malpractice, really negligent, terrible. So, and I'm holding my tongue. That's terrible.
No, it is.
But any excellent person that works with vestibular therapy who would get you on a table, put some goggles on you in the dark, check you this way, determine exactly where the problem is. And if it's not something like that, then it's the next level and it would require a little bit more intervention.
Sure.
Not surgical, not medication, but something to do with recalibrating the vestibular system and its projections into the brain. Yeah, very doable. So
and this is
we'll talk more after the podcast and see if we can't get you somewhere near where you are.
And this sounds like, so this is right up what you do daily in your practice, right? It sounds like this is stuff that you are treating. So why don't you tell me a little bit about like what are some, if you can share some of the stuff that you have seen and also how the person has improved, because I'm really interested. Like I said, I went down a deep dive, but I didn't even scratch the surface of everything that you do. And I didn't know that this existed. I didn't know that there was such a thing as this functional neurology. I never, I hadn't heard of it before, but I'm very, very interested. Take it away.
Yeah. So the difference between what we do in functional neurology versus traditional neurology, what most people would experience, I went to a neurologist, is, and I'm going to bring it down a level here, so it's not completely fair. I'm going to generalize it, but you go to the neurologist and they're going to do some tests maybe with you and check some things. And then they would say, no, we're going to send you to an ENT because you have dizziness. We're going to send you to the ENT. ENT would check your hearing. They might check have you stand in the room, one foot in front of the other. They may do that. They may put goggles on you. They may do the test called a caloric, where they put some warm and cold air in your ear to see how your eyes move. So those are some standardized tests. But a neurologist, go back to that, is typically going to be providing medication, pharmaceutical approach.
Right. Yep.
Functional neurology is exactly what that first word is, functional. Understanding what's going on in the brain, whether it's the sensory input from the visual system, from the vestibular system, however the brain is working, understanding how it's working, and then creating a protocol, if you will, to rehabilitate, strengthen neurology, nerve connections. So, and I was talking with this patient yesterday who is 80. He's in great shape. He's brand new. I saw him several years ago. He's had a fall recently in the yard. He fell on his shoulder, and then he ended up having problems with his brain, feeling very bad, dizzy, brain fog, slowed down. He didn't hit his head.
Okay.
So they cleared him from the hospital. He comes in. So we analyzed his brain. We did an EEG, want to know what the brain waves are like.
Okay.
We looked at his vestibular system through specialized goggles in a very high-tech chair that is designed to move you at certain frequencies. So I can determine what frequency does your system break down, right?
Oh,
Like some people might say, I get sick in cars, but only when we're going at a certain speed, or I get sick in boats or, these things. So
yeah.
there's certain frequencies. And when we can isolate the frequencies, this is how good it is that the system breaks down, then we can train and strengthen it at that one.
Okay.
You can think about working out for
Yep.
that, right? I go to the gym, I can bench, I'll just say 60 pounds, no problem. But I get up to 125. Oh, I can't do that. All right. So we're going to work at 60 and 70 to get you stronger. And then, so we can map out where in the brain or the vestibular system the imbalance is, then create a functional rehab approach to build neuroplasticity to strengthen the brain and or the vestibular system and how it connects in the brain stem and the parieto-temporal lobes here, and now improve function for that person, help them get back to what they want to do. In your case, it would be being able to turn either way,
Right.
either way without even thinking about it, So that's the difference between functional neurology and neurology. And we have colleagues all over the world, all over the
Yeah.
world.
See, that is incredible.
And as I mentioned, usually a PT who's specialized in vestibular therapy could do much of the same positioning maneuvers. They may not have the chair and the device that we have,
Sure.
the multi-axis rotational chair. That's a higher tech piece of instrument.
Yeah.
Yet because we have a lot of other cases where we have vestibular injuries from concussions or vestibular injuries from immune problems, post-vaccine related, or neuroinflammation or Lyme, migraine headache
Ah,
sufferers. We're
okay.
analyzing everyone in the chair because
Yeah.
the vestibular system does so much. Dizziness is just what most people relate it to, but
Sure.
there's so much more, so much more.
Yeah, one of the things I think that I had saw too is brain fog, which I think I that's probably one of the most common things that I hear from people is people talking about having brain fog. And so
Yes.
it sounds like that's one of the things too that you're able to treat and or look into in your practice as well, right?
Yeah,
And so
absolutely. Look into for sure. Try
what
to understand what is the cause of it because there's
yeah,
different ways that it could present.
yeah, and that's
Yeah.
what I was going to ask. And so I was also interested in um some of the how about mental health stuff? Like is there obviously I know most people are going to go to counseling therapy and I'm not arguing that that is needed, right? So I'm not saying that, but is there also a place for functional I like multidisciplinary. I way back
Yes.
when worked in inpatient treatment for drug addicts and alcoholics. And I always thought that a mix, like nobody has the key by themselves, right? So AA, NA are just as important as a solid outpatient treatment as a coach or a
Agreed.
sober buddy, whatever you, right? And so I look at
100%.
multidisciplinary. So I start thinking about like how we treat because one of the things that brought me to this, let me back up, I apologize, is when you said medications, right? We are so quick, I think, to prescribe medications. And so one of the things that I think about is all of these people like myself who have been prescribed SSRIs and things over the years. And
Yeah.
I always think about like, when do I get to just be me again, without the medication, without these masks, without this stuff? And I was wondering if there's an approach to what you do for those things as well.
It's a good question, because we're really looking at everything in terms of human beings, in terms of the way they're dealing with conditions. We look at everything from a different angle, right? From a bias. And I don't mean a negative. I mean a bias, a different
Yeah,
angle. We're looking at it and like, wait a minute. Okay. Medication, mental health. Okay. Let's look at it from this angle. Okay. Can we find where is depression in the brain,
right.
right?
Yeah,
Where is it? What do you mean, doctor? Where is it? Where is the brain in a lowered or higher state of function? I never heard anyone ask me that. Well, I'm asking. So we know in the literature, if your left frontal lobe is low in activity, you are probably going to present as someone who's depressed.
right.
We know that if you have high beta brainwave activity in your cingulate in the midline, you are most likely going to be anxious. And
Ah,
you might even have OCD. So you see, these are just two examples. But this is where we're like, okay, now what can we do with the left frontal lobe? Can we strengthen it? Can we use transcranial photobiomodulation, a gigantic word?
Yeah, that's a
Can
lot.
we use light therapy over the left frontal lobe? Can
Ah,
we do that? Would
yeah,
that help this person? Let's find out. It's safe. It's non-invasive. What dosage should we use? So we run through this algorithm, right? This workflow. Like, where is the problem? Where is ADHD?
that's a
It's in
great
Adderall
question.
and Vyvanse. No, it ain't in that stuff. Right?
Yeah,
That
which that's
can
a
be a
great
short
point.
term.
Yeah,
But let's figure out where in your brain the problem is emanating from, and let's try to improve it.
right.
I also, like you, had a little exposure with some people that have suffered with addiction. And I
Yeah,
thought, man, if there was a hyperbaric chamber in here, man, if these people were doing neurofeedback every day along with the counseling thing, man, if they improved the nutrition in this place,
yeah,
man, these people would really do have a better chance,
right.
better chance to do better, absolutely.
What holds us back, do you think? Like, I've heard of the hyperbaric chambers being excellent. For matter of fact, there was somebody. Oh, I don't want to tell the wrong story. Somebody. So I live in central New York. Lyme is rampant here.
Yeah, big
And
time.
we had several close friends over the years battling Lyme. And one person had a teenager who had gotten so ill from Lyme that they had lost the use of their legs, which I had never heard of anything that dramatic
Mm,
before. But they left New York State. They went to, it was one of the southern states, and I unfortunately can't remember. I wasn't prepared to tell the story, so I apologize. But anyway, they went to a hyperbaric, a place that had a hyperbaric treatment, and they greatly improved. And
mm,
so I had never heard of that style of treatment before then, but I hear that this is amazing for the body. And so
that's
I'm
right.
just kind of
Yeah.
curious why that is, or if you know, like, what is it about that
Well, oxygen is the essential nutrient.
good
You
point.
could say it that way, right? Oxygen is the essential nutrient. Without oxygen, you're not going to make it more than 5 or 6 minutes,
True.
unless you're one of those deep divers, and maybe 7 or 8 minutes.
Yeah, right, right.
That's why it is the rate limiting thing for your brain. So when you can provide greater oxygen, now when we put a pulse oximeter on someone and it says 99 or
Yep.
100, that's the full amount of oxygen you can get at sea level, or even in mid upstate New York or anywhere, even in the mountains, right? 99, 100%. That's all your body can saturate.
Hmm.
But when you get into hyperbaric, the pressure is kind of the magic. It allows you to super saturate oxygen in your tissues. Now you can go upwards over that 100% mark for a short period of time, because when you get out of hyperbaric, then you're off gassing. But while that oxygen's in there, it's able to do some fantastic things inside the physiology, inside the brain. When people have inflammation and neuroinflammation, gut issues with their microbiome,
Hmm.
post-surgical, there's a lot of plastic surgery in Miami,
Yeah,
and a
sure.
lot of the plastic surgeons
Yep.
are having hyperbaric oxygen chambers associated with their clinics because you recover faster from surgery. Can you imagine in a hospital who have many times hyperbaric, if they went hyperbaric surgery, people would get better faster.
Yeah.
What's the issue? To be non-naive, I think it's that,
Yeah.
which I'm making the symbol for, like, money. I
Yep.
think money is involved with these things, right?
Sure. Sure.
Which you would say, well, they could actually make more money, the hospital. If they did. I don't know exactly. I don't work in a hospital, but
No, no, I know.
money is the root of a lot of why things happen or why they don't happen. Unfortunately, fortunately, whatever you might think.
Yep. No, I agree with you. I think that's a great point. And, you know, I try to be careful and not to be critical because, we all want to earn money, right? I mean, that's what business is for. That's what that's about. So I try not to get on too much of a soapbox, but I do get discouraged sometimes by pharmaceutical companies because I do feel like at times that's the only thing that's preached to us, right? How many commercials do you see for medication in a day?
Yeah.
I mean, I've self-diagnosed myself over 100 times now, or a million times probably. Oh, I should probably ask about this. And then I think to myself, why? Why would you do your physicals? The doctors never said, are you having problems with, I don't know, this? No, but the commercials almost make you think that you do. I guess, in my opinion, you know what I mean?
There's billions and billions and billions and, and more of that going on in that industry. And look, we need some of those. They're life-saving
Sure.
at times.
Agreed.
And we know when you have that amount of money involved, there's going to be things that are not some good and then some not so good.
Right.
And like you said, I'm with you. Look, people, they provide a good service. They should be compensated. Excellent. Where I kind of like I said earlier, when you went to the ER,
Mm-hmm.
get bothered because I am one as a physician.
Right.
And I want physicians to show me that you're thinking. Show me that you're thinking, doctor. Which what do I mean by that? I would never say that to a doctor, but
Sure.
it's in my wheels because I say it to myself. Show me that you're thinking about this, Mike, about this person, not just saying, well, it looks like this and smells like this and tastes like this, so it must be that, right?
Right.
You have to carefully get through the history and then consider. I've been doing this 35 years, and I know some of the most important information is what I like to call slow medicine. Slow it down. Don't give me a 5-minute visit with somebody
Right.
and give me a drug because I want to know what's the rationale behind that. Why are we doing this? That's all. If you give me a good rationale, even if I don't understand it, I'm open to that.
Right.
But show me that you're thinking. That's what you went and learned about, is to be able to, go through things in your mind with your experience and show me that you have that
Right.
and that you're working through. And you're not just saying, well, that's this. Okay. That's okay. There's pain. That's just headache. That's not great.
No, I agree. And it's weird. You got me thinking, because I'm thinking back now to being in the hospital and being told that I had vertigo. And I started thinking, I'm like, why didn't I ask more questions? I guess like I was so trusting of like, oh, that's what it is. I'm going to go home. I'm going to feel like crap for a few days. And then hopefully it goes away. And then I guess it kind of did. I mean, it's not that bad, right? So
But
it's
we
like
we
one of
wanna
those
be
things
able to
that's
trust.
tolerable.
We wanna be able to trust. I wanna trust
Yeah. Yeah.
the person that I consult with about insurance. I wanna trust the person I consult with about, whatever it is. I need to trust in them, and unfortunately, sometimes, and I'm like that too, like in these other areas, right? Other realms that I'm not an expert in,
Right.
but, sometimes they might have a very narrow range of knowledge also. And so they don't have much. They may have very well 100% believe that you just kind of this is a self-limiting condition,
Right.
and that's what you ride out. They just didn't have enough exposure to other people having that to say, oh, no, this is the way you actually progress through that, right? So
Right.
we'll,
Yeah.
we'll give them the benefit of the doubt.
Yeah. It's just it's just crazy. So I want to go back to on another comment that you made. I heard you bring up ADHD. And so this is something that is more current, but I feel like there are a lot more adults being diagnosed with ADHD nowadays. Do you agree with that? Do you feel like, or is it just because I don't know if it's that phenomenon that because it's being talked to me that now I'm more aware. So my view has widened, right?
So I want to say this. I want to say it properly for your listeners and for people. And this is my only my experience,
Okay.
small sliver of people,
Fair.
and then my view of considering the culture.
Sure. Fair.
I see a lot of young, mostly boys, every once in a while, girl, teenagers with ADHD. Their
Mm-hmm.
parents come to me looking for something different. So that's quite a large percentage of our practice.
Mm,
And some of the older teenagers have told me it's actually everyone, because I started to notice there's so much more of this.
right.
Not only ADHD, but also anxiety, OCD, depression, da, 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 da. And some of these young adults, teenagers, would tell me, actually, one of them was really bothered because she really dealt with ADHD, but her friends would say, no, I have ADHD also. I have this, I have anxiety. So there's a little bit of a kind of a grasping onto some of these conditions.
Mm,
It's like an identity, right?
yep.
An identity. Now you say that's kind of weird. Why would people do that? If you work in healthcare long enough, people will attach sometimes to their illness
Yeah.
as
Yeah.
that's their identity.
Mm-hmm.
And then other people, especially maybe younger ones. And then I had another gentleman who was older, who was very successful, and he got diagnosed with ADHD because he wanted the Adderall.
Oh.
Why? Because he could work 14 to 16 hours a day and he wanted to be a millionaire before he was 40. That guy, I told him, I said, it's going to burn you out. It's going to burn you out, man. So I helped him do some brain training, and I gave him some things to work on. And he's actually very successful. But you see, there is a whole nother side.
Right.
So you have people who actually have attentional issues because the brain networks are having some different ways of working that are not so good.
Mm-hmm.
Then you have people that identify with things that may or may not really have it. And then you have people who are wanting the drug because productivity,
Right.
because it's, you can do it.
Yeah.
So we're going to put all that stuff off the table for a minute. Now we're going to talk about ADHD.
Mm-hmm.
So we know that the right side of the brain, the right hemisphere, is the side of the brain that controls the primary amount of attention that we have. The right side of the brain. So many times when we're analyzing someone, if the right side of the brain has imbalances, we're saying, maybe that's the source of their attentional issue and we need to train it. And there's different ways to train it.
Okay.
And we look at other areas as well. So we start looking at that. Now, my wife will say that I have ADHD. And I'll say, no, I don't have ADHD. But I have, unfortunately, because of my environment, trained myself to read things in very small quips, right?
Right.
Something on the phone, some short article. And so I've shortened, because of my environment, my ability to attend to things.
Mm-hmm.
So that's self-imposed. And I need to scale that back.
No,
so
that makes sense.
What am I saying? I'm saying, yeah, some people have issues with attention, and it would behoove them to get some analysis to know where is your brain going and what's happening, to determine if you can do continuous performance tests, CPT tests, that, with a neuropsychologist or someone who works on a computer, and it will give you a diagnosis. Yes, you fall in the category.
Right.
I'm more interested on what's going on in your brain and where can we train it to improve your attention, either while you're on meds or not, so that you may not have to be on that forever. We would also look at your metabolic components, meaning what is your diet like and what is your blood profiles look like? What do your genetics look like? Because genetics affect neurology, right?
Yeah, absolutely.
And what you're putting in this mouth all day long or not putting in can affect the way your brain is. If you have food allergies,
mm-hmm.
sensitivities to different foods, that can cause an inflammatory response in your body that can cause you to have attentional problems. How about that?
Yeah. I mean,
so we've taken kids off of things and their parents say, I can't believe it. They're like 50% better.
Yeah.
So there's a lot of pieces to look at, right, Sean? A lot of things.
Yeah. No, I'm following it. My brain, see, this is the part where your head starts spinning, I guess. But yeah, this is the stuff. I love this because I go down that rabbit hole of thinking about, well, and you've already talked about it. Again, I told you I was going to plug the Neuro Collective, and here's a podcast I think that everybody should listen to, The Gut and the Brain Connection. I know that you just did a podcast about this. I found myself listening to it at work the other day, and I really started thinking about nutrition in a different way, because I started thinking, like, what I put in my body, right, is going to, I know that it impacts. I know, for example, if I go, and I don't want to throw any businesses under the bus, but if I go eat a certain place at lunchtime, I may not feel so good. All right. So if I go eat McDonald's for lunch, I'm not feeling so hot come 2 o'clock, 3 o'clock in the afternoon. My body's sluggish. I don't have the energy. I just don't feel well, right? And I know that if I pack a salad for lunch, that I feel much better at 2 o'clock, 3 o'clock. I actually don't need that afternoon cup of coffee or, energy drink or whatever to kind of get me over that last bump of the day, because I've ate better. So I've noticed that in just my own, just thinking about it on my own, I guess,
That's excellent.
Yeah.
So, I mean, if we can just become a little bit aware and then do the next step, whatever it is, like that, like, okay, it doesn't mean I don't eat perfectly. I enjoy this and that.
Sure.
I like coffee in the afternoon. And I agree with you. If I fuel myself better through the morning, midday, I'm feeling better, and my sleep is better too.
Yeah.
And sleep is critical to attentional issues.
Oh, yeah. I've definitely noticed that. I have absolutely noticed if I eat too much at night, if I go on a snacking binge, so I have a bad sweet tooth, and I have to remind myself to stay away from like the fruit slices and all that gummy stuff. I love all that stuff. But the problem is if I bring it into the house, I'm going to snack on it.
Yeah.
Yeah, exactly. And so, yeah, I've noticed that. Eat a lot of sugar, go to bed, don't feel so hot in the morning, right?
Yeah.
And it does. It makes sense. It seems almost like, okay, that's common sense, but it's also not common sense because we don't think about it in a sense. We're all just marketed this stuff.
Yeah.
And,
It's true.
you know, I certainly don't want to turn political, but I think that the attention to our diet and that conversation is being had. I think that's good. You know, I
Yeah.
don't, that's,
Agree.
that,
Agree.
I don't, you know, I think it's good. I think that people need to start thinking more about their diets. And I think that that's an
Yeah.
important. So yeah, I
I agree.
definitely agree with that.
I got to tell you this story, which is quite interesting.
Okay.
And you reminded me of it earlier, but I'm going to take a few steps back.
Yeah.
I had a gentleman to come in, and I hadn't thought of this in a long time until you mentioned something. He was highly educated, PhD. He worked in online education,
Okay.
and he came to me and he said, I've read about neuroplasticity, and he was dealing with suicidal depression. So
Oh,
he was in I'm going to say he was probably in his late 50s at that time.
okay.
So brilliant guy, brilliant guy. And he said, so you're really my last hope, is to see if something that you can do can help me with this. This is beyond my depression.
Mm-hmm.
So we analyzed him. And the one thing that I remember is that I ended up checking. Have you ever had it's one of my standard questions, any dizziness, any vertigo in your history, any motion sickness in cars? No, but I did have this bout with dizziness many, many years ago, like 20 years ago. I said, okay, well, we're gonna put him in the goggles during the exam, and because he had that, and I'm just gonna check him. And sure enough, when I put him, his eyes started to move like what we call a nystagmus. Boom, 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 boom. I
Wow.
said, oh my goodness. So we stayed there. This is during the examination.
That's incredible.
So we stayed there maybe a minute and a half,
Mm-hmm.
and then I went through the procedure of repositioning it, got him up, finished the examination. He came back and he stayed with us for a course of care for several months, multiple times a week. But he said when he came back, he said, I can't believe what you did the other day. I've had that on and off for 20 years.
Yeah.
Like you've 17, right?
Yeah.
17 or 7?
17.
17.
Yeah.
He said, I haven't had anything alleviate my mood like that ever. And I said, are you kidding me?
Yeah.
During the examination, the repositioning process for him, now that's not everybody,
Yeah.
but for him, he went on. So he was out of work at that time. He could not function. He went on to go back to work, to open up a mindfulness center. He went back into mindful training, opened a mindfulness center here in South Florida.
That's incredible.
And was very successful. I couldn't believe it. I was like, see, all we're doing is hopefully finding the source of the issue,
right,
correcting it as quickly as we can. And not everyone is that easy. Not that situation was one of those, but I haven't thought of that in a long time. And you reminded me that when you said something about mental health, suicidal depression, he said nothing has ever alleviated it like that in one day.
That's incredible.
So it was creating such havoc in his neurology.
Yeah.
Even though he wasn't constantly dizzy, but when I provoked it, it just came out like, right. So what a story.
No,
what a story.
That's incredible. That's incredible. Yeah. I got goosebumps now. And those are the kind of stories that I hear as well, just I don't want to say unfortunate because everybody has a story, right? And their story, I don't know where I was going with that, I guess. But the point being is that there is hope. And I love that because that's one of the things that I tell people all the time is the reason I do this is to keep talking about it because my hope is that by continuing to talk about, mental health and being a male, especially and mental health and, hey, let me be vulnerable. My hope is that these conversations lead to exactly this conversation that you and I get to have today. Like I know that there are other avenues for people to take for their healthcare. And I think awareness is key. We're just not aware. So again,
yes,
these conversations are so important because it brings awareness that, hey, listen, there are other things that you can try to help alleviate, whether it's, suicidal depression, whether it's vertigo, whether it's ADHD, whatever it is,
Yeah.
I think people get lost sometimes because they feel like nobody's listening to them. And I think to have
Sure.
somebody like yourself who's like, wait, we're not out of options yet. Because again, you go to the doctor, right? And they say, all right, we're going to run this test, this blood work, but you're fine. I don't know. And then I've
True.
had so many people tell me they feel crazy. Like I feel crazy. Like, um, talking with people who have Lyme disease to bring that up again. I have talked to so many people who are like, I'm pretty sure it's Lyme, but they're not going to test me for it because in New York State, you got to have so many bands before they'll treat you. And so
Right. Yeah.
I didn't have enough bands or I didn't have this, but I'm feeling this symptom and I'm feeling this, but they keep telling me I'm fine. And no, keep pushing. You're going to find somebody to talk to. And that's what I love
Yeah.
about, this conversation with you is no, there are other options, Again, I've never heard of functional neurology before, and here we are talking about it. Now I'm curious, who practices in my area? Who is there to talk to
I
up
know a
here,
couple
you know?
people in the city. I know a
Yeah,
couple, and one in New Jersey, a couple in the city, like right across the river there. So yeah, there's people up there. I don't know about upstate. Not
yeah,
too, it doesn't come to my mind quickly, but I definitely know someone on Long Island, someone in Manhattan that are just brilliant guys.
yeah.
Brilliant.
And I think that's
So
incredible. So I love that we get to have this conversation for that reason, because I think hope, in my opinion, is what the show really is about.
yes.
Let's tie a knot. Let's hang on.
Yeah.
Um,
I love it. I love it.
so
Um, Go ahead. I have a note here that I wanted to share with you is that the vestibular system,
yeah,
most people think about balance, dizziness, and vertigo. They
okay,
think that if you don't have vertigo, you don't have dizziness, your vestibular system is fine. And I'm going
hmm
to tell you this is interesting. As we age, which everyone knows this, everyone knows what I'm going to say. As we get older, our body gets a little weaker.
yeah,
We can strengthen it, and we should. As we get older, our eyes get a little weaker, the sensory input. And that's why I have glasses.
yeah,
So,
with you.
and guess what? Our vestibular system gets weaker too.
Mm, makes
That
sense.
is not thought of too much
Right.
because, again, dizziness, vertigo, oh, you must have a problem. But if you don't complain of that, no. But you mentioned some things like ADHD or attention issues, not even diagnosed, but attention.
hmm
I'm having trouble with concentration, focus, cognitive issues. I'm having trouble regulating my heart rate when I get up and down, like a dysautonomia,
Right.
anxiety. These things may have a connection in the vestibular system as it weakens as we age. Or younger, you say, no, I'm not older. I'm only in my 30s or 40s, but you can have asymmetry. So one side could be firing a lot more than the other, and this can really play havoc with your brain.
Okay.
And so those are the kinds of things we analyze with people. So whether you have dizziness or not, when someone walks into this center, I analyze their vestibular system because it is a primary sensory input to the brain.
Yeah.
And I measure how their eyes track, not their acuity. I leave that to the optometrist,
Sure.
but how their eyes track up and down, side to side, how they can, converge on something. That I measure because that tells me about their brain health very much.
Ah. So I'm going to throw one for you. Just because I have been diagnosed with, I was going to tell you, keratoconus.
Okay.
So it's basically just a severe astigmatism from my basic blue collar understanding, right? So with that being said, also obviously I told you being diagnosed with vertigo. Do those things, in your opinion, go hand in hand? Just using myself as a guinea pig?
I would say it differently. I
Okay.
wouldn't say they go hand in hand. I'd say there may be a correlation. There may
Interesting.
be. How would you know that, Dr. Bang? I'm talking to myself.
Yeah.
How would you know that? Well, I would analyze someone's, of course, their vestibular system because they're
Sure.
dealing with what you are. But I'd also measure their vergence, their ability to converge on a target and because that can affect their depth perception when they have stigmatism.
Yeah.
So now we could have a depth perception problem, which can cause your eyes to not to have an asymmetry in movement
Yep.
when you're looking at the computer, when you're looking at your phone, when you're looking out in in your workplace, coming back to something on your work table. And as you have that asymmetry all day, that can cause you to have dizziness too.
Mm,
So I would say there may be a correlation, Sean. Let's measure it and find out if it really is.
yeah.
That's what I would,
Yeah. It just got
right?
me. It got me thinking how all of these systems kind of play together.
Yeah,
And
that's right.
that's what got me thinking about it. So, Man, this is,
Yeah, if we started measuring your convergence and we saw an asymmetry in our specialized goggles, and then I did some test table side and you said, whoa, I feel dizziness again. There sounds like there's a correlation,
yeah,
right? A clinical
exactly.
correlation.
Yeah. Man, I think I'm going to need to come down to South Florida, which I need
You're
to
always
do anyway.
welcome.
Yeah. Yeah. I
Always welcome.
appreciate that. So before I move into our fun segment of the show,
All right.
anything in closing that you want to say about your practice, what you're doing, the work that you're doing, anything, any sound bites, any clips you want to give the listeners?
Let's see. There's so much connected to the vestibular system. I like what you said, the awareness. Awareness is a big word. If you're dealing with something, guys, myself included, we tend to be like, no, 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 I'm okay. No, 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 I'm
Mm-hmm.
okay. I don't need anything. I'm good. But I would say to the men listening, it's okay. Find someone that can help you kind of figure out what's happening. I'm that way. I am totally saying this, and this is the way I am. So I get it. But maybe you picked up something here. Maybe you're dealing with something and man, I think I need to just get checked out by one of these functional neurologists. You
Yeah.
should do that. It would be worth your time because you can actually learn more about how your brain's working, even if it's not a solution for you,
Right.
through one of my colleagues around the country, all over the place. Your listeners are probably all over. You can
Yes.
learn more about your brain. I tell people when you leave here after 2 hours of me analyzing your brain, you're going to know more probably than you ever heard before.
Yeah.
Right. So
Yeah.
that's worthwhile, guys. That's worthwhile.
Yeah.
So
I
we're
agree.
always here to help. We like to provide hope, awareness, and then if we can, actionable steps to
Yeah.
return your brain health.
So incredible. So incredible. I like that. I like it a lot. I think that what you're doing is so beneficial. And I'm so happy that you ended up finding me and coming on. I think that this is incredible. Um, and I encourage people, like, advocate for yourself. If
Yes.
you go like myself, if you go to the ER and it doesn't just seem quite right what they're telling you, it is absolutely, I know for me, I have a trouble. I see doctors as authoritative, right? And I have a trouble arguing against anybody who's of authority, right? So for me, I might have a hard time questioning a doctor. Well, they told me it's this. And then but I am also going to recant that statement and say, if your gut's telling you that just doesn't seem right, push. Go get a second opinion.
Yeah.
See Dr. Bagnell or see somebody like him. He mentioned that there's people around the New York area. Do some research.
Pennsylvania, all over
Yeah,
Pennsylvania, Philadelphia,
yeah,
Hershey.
exactly.
You mentioned something good there because I get like that too when I have to go to the hospital with a family member,
Sure.
and I have to kind of catch myself because I get a little on guard.
Mm-hmm.
And my wife said something years ago. She used to be a doula.
Okay.
And so in doula work, helping women have their children,
Yeah.
babies, right? So I learned from her, you need to get them on your side, medical people. I don't even, as a physician, I don't like to be challenged.
Sure.
I don't
Sure.
mind being asked questions, but I don't like to be challenged. Okay.
Yep.
So anyway, all that said, a way to kind of talk with them and say, doc, I know that you said it's this. Can you help me figure this out from even looking at lab work? Can you help me, right? Can you help me to figure this out on a deeper layer? Because it's not solved. Can you help me? Something in that realm.
Right.
You see, now I'm asking you for help.
Right.
Rather than saying, I don't think that maybe you're not, it just kind of puts me in a position of, I need help. And I don't like to do that as a guy.
No, you're
But
right.
It's something in that, maybe that can be a help to someone who's listening and they have to talk to doctors.
Yeah, no, that's a great point. And I think our delivery is key, right? How I approach things. Yeah, that's such a good point. So now I'm going to spring a question on you, doctor.
All right, let's
ready?
do it.
All right. So one of the segments that we do here in Vertigo is what's on my playlist. And so I'm going to go first. So I'm going to put you on the spot. I'm going to ask you what's on your playlist. But this is kind of the fun segment of the show as we wind down. I have to be honest. Today, I've been on a Toto kick. I have been completely lost. Man. All of those, listen to Africa. Listen to Africa, Rosanna. Yeah, just going down, listening to all the and I got to admit, Toto has a lot more songs that were on the radio than just the two that I actually thought that I knew. So that was pretty incredible. So now your turn to be on the spot. So what's on your
Well,
playlist? What's getting you through your day?
I I don't listen to music every day, but
Okay.
I have a few things downloaded here. Like my wife has Spotify. I don't have it on my phone.
Yeah.
I don't get a chance to do that very much. But I love to listen to, and my son turned me on to it, who is a musician, by the way, in
Okay.
his band. He turned me on years ago. He's a jazz. He also plays jazz and plays electric
Oh,
guitar. But
wow.
I love French gypsy jazz.
Okay. All right.
I like that. And
Yeah.
then, but recently, after that movie Maverick, remember the movie just Maverick with Tom Cruise?
Yes, I
I
do.
love. There's one song when they're doing the football, the dogfight football, and they're going
Yeah.
against each other, and it's I ain't worried about it right now. I ain't
Yeah.
worried about it right now.
That's right. Okay. All right. All right. All right. Yeah.
It pumps me up. But I like Red Hot Chili Peppers. I got that on my
Ooh.
phone.
All right. Chili Peppers fan. All
So
right. All right. That's a good
going
throwback.
back, I was big Doors fan back. I'm a bit older probably than you. I'm in my early 60s, so I was a big Doors fan and
Okay.
Boston and all Journey. I saw all those bands in concert when I was younger.
Oh,
I
wow.
don't listen to them that much anymore, but
I
of
know.
course, like you mentioned, Toto, I love them.
Yeah, man. Yeah, Steve Lukather on the guitar. Yeah, I can go down that rabbit hole. I'm not going to do that because I know you've got patients that are waiting. But I do want to say thank you, one, for being such a great sport and playing along on that segment. But
You're welcome.
and first of all, the Doors are pretty incredible. I got to admit.
Come on,
I
Jim
went through
Morrison.
I went through a Doors kick in high school, which I think was normal. So I graduated in '94. And the 90s were the 60s. That's when they tried to redo Woodstock and all. Yeah, whatever. That
Yeah,
was such
yeah,
a, yeah,
that's
we'll just
right.
forget
That's
it
right.
that they did that. But yeah, oh gosh. So it's so great. Thank you so much for coming on. I really appreciate you taking the time out of your day. Again, Vertigo listeners, please, if you have questions, get them to me. I can email them or whatnot. But also even if you're looking for a functional neurologist in your area, email me. We can network. We can try to figure this
That's
out.
right.
Yeah. So
Oh yeah.
I absolutely appreciate it. And Vertigo Nation, I hope this episode made your head spin.
Yeah, I love it.
All right.